You'll hear me frequently say that liposuction is mainly an adjunct to skin removal. That means that liposuction is rarely a good procedure as a standalone procedure. And the reason for that is the results in liposuction are related to the quality of the skin. You have to be young, you have to have very tight skin to have good results in liposuction. Certain areas of the bodies tend to have tighter skin than other areas, such as the back. That tends to respond better to liposuction than areas that have inelasticity. The problem is that patients want liposuction in areas that have the least skin elasticity. So knowing that, what do you think the most commonly botched and deformed areas are after liposuction? They are the area around the belly button, which tends to have the most stretched out skin after pregnancies, the back of the arms, and the inside of the thighs. So what does that mean? That means that rarely should you be having liposuction alone in those areas. Liposuction should be done with your arm lift, with your tummy tuck, or with your thigh lift. It can be done in very small amounts in certain areas, but the problem is that surgeons are out there to please patients, and doing a little bit oftentimes will not make patients happy. When patients have thickness around their abdomen, they think that liposuction will treat that. And again, you just have to be aware that if your skin is not tight, liposuction is not a skin tightening treatment. Adding heat, radio frequency, that sort of thing does not make it any better. All right, those are very expensive equipments that a lot of surgeons purchase and make make big promises that they're going to resolve the laxity in skin. And as I tell patients, if those things really worked, we'd never need to do tummy tuck surgery, right? Everybody would just have skin tightening. So even if there's a modest amount of elasticity and you go have those liposuction procedures, it's going to create damage in those skins that will create the need to have those surgeries. So if you have liposuction around your belly button area and your skin's not elastic, you may no longer just need a tummy tuck. There's a good chance you're going to need a fleur-de-lis skin removal to remove that vertical skin. Same thing with the arms. If you now have liposuction in your arms, and the only way to fix that may be to do an arm lift. So think you came in thinking you could just have liposuction alone. Now you're needing skin removal with big scars. So make sure that you're seeing a surgeon who is an expert in skin removal. All right. You cannot be a liposuction expert without being an expert in skin removal. If you only offer liposuction alone, you're either not a real plastic surgeon or you're not somebody who people should be going to see. Keep that in mind and you'll have great results.